mind. I walk the line.
Welcome back to Q13 Fox News this morning. Time right now is 8:12. So millions of Americans suffer from sleep apnea, and a lot of them don't even know it.
If it is untreated, sleep apnea increases the chance of heart disease, diabetes, and cancer. And the Seahawks teaming up with doctors for a big event this weekend to raise awareness of this potentially serious problem. And joining us now, Dr. Steve Carstensen from the American Academy of Dental Sleep Medicine and former Seahawk, Alonzo Mitz.
Thank you.
Good to have you guys. Thanks for coming on this morning. Now, doctor, you say there are two kinds of sleep apnea. Can you explain that?
Well, sleep apnea comes with when people stop breathing at nighttime when they sleep. Okay. Part of it is because the tongue can block the airway, and so that's called obstructive sleep apnea. And the other is a funny kind when the brain stops trying to breathe, called central sleep apnea.
So a lot of us wake up in the middle of the night for various reasons. How would we know if we have sleep apnea? What are the warning signs?
The biggest warning signs are snoring is one sign, and then also if somebody observes you choking and gasping. If you just wake up calm, that's one thing. But if you wake up and gosh, you can't breathe, or you're panicking, that's a different sign.
Now, Alonzo, you've suffered from sleep apnea. In fact, you do right now.
Yes.
How did you know that this was the case with you?
Well, actually, Nesbitt Glasgow and I was on a golfing outing, and he woke up the next morning. He said, "You scared me last night." And I said, "What do you mean you scared me? Did I sleep ugly?" He said, "No." He said, "You stopped breathing several times." And I was like, I started tripping a little bit. I was like, "Are you serious?" And if it scares Nesby, I know I need to get it done. So I went and got tested, and it was more than just a couple times that I stopped breathing in my sleep, and it scared me more so to do what I need to do to get this, because I was stressing and going through quite a bit of, stress at the time.
And so what are you doing now to combat this?
Well, I'm teaming up with him, of course, and a few others, and they actually this weekend they got a event at CenturyLink with Jacob, of course, going to be there in Nesby, Glasgow, and they're going to do free testing, and I'm going to just be a part of that.
Now, doctor, if I'm snoring and I'm waking up a lot during the night, does that necessarily mean that I have sleep apnea?
No. Snoring is you can have just simple snoring. But the most important thing is to get tested, because you're at risk. And so we work with our physicians to get a diagnosis done to see what kind of treatment might be the right choice for you.
Every time we hear about people getting tested, they go into these big clinics, they're hooked up to these big machines, and that's how you can try to help people fight it. But I hear you're coming up with some great new innovations that you're going to be talking about this weekend.
Absolutely, because the clinics where they sleep overnight and have the machines, that's one kind of a barrier to treatment. A lot of people don't want to do that. So the companies have come up with some portable monitors that the physicians can use to get a pretty good idea for what people are sleeping like at nighttime.
Okay, if somebody has sleep apnea, I've always seen those big machines that they hook themselves up to, and that apparently helps them. Is that the way to treat it nowadays?
How's that working for you?
It's I can't sleep the whole night. Matter of fact, what I do, I put the machine on probably 2 hours before I go to bed. Because I go to bed, when I wake up about 45 minutes later, it's on the floor. It's not on. Like, I just can't sleep with it the whole night with it on.
What's the name of the machine?
It's called a CPAP machine.
Okay.
It's a mask with a positive air pressure.
Okay. And how does it work?
It works great. It blows up the air a little bit behind the tongue, so it keeps the airway open so we can breathe. Unfortunately, a lot of people can't use those. Like my friend here can use it for about 2 hours. Well, that's not enough. No. So dentists get involved, and we make an oral appliance that holds the jaw forward and it brings the tongue off the back of the throat.
Oh, wow.
So physicians and dentists work together to find the right solution for us.
Dr. Carstensen and Alonzo Mitz, good to have you guys. Thanks for coming on this morning. And the Tackling Sleep Apnea event happening on Saturday, July 14th at CenturyLink Field. It starts at 2 o'clock. And to find out if you are at risk for sleep apnea and to see if you qualify for an in-home test, you can visit www.sleeptest.com.